Picture this. You are a Korean soldier. You have a bullet lodged near your lung. You are being carried onto a Canadian destroyer in the middle of a war, and the only surgeon on board is, right now, hiding in his cabin, reading a textbook called General Surgery, trying to figure out how chest surgery works. You survive. Everyone survives. All 16 of you. This is the story of Ferdinand Waldo Demara, Jr. The year is 1951. The ship is HMCS Cayuga, a tribal-class destroyer of the Royal Canadian Navy. The surgeon is a man who, 8 months earlier, was a fake monk in Maine. Before that, a fake lawyer. Before that, a fake college instructor. Before that, in actual prison for actual desertion. He has, on this day, exactly 0 hours of medical training. Let us back up. Demara is American, born in Massachusetts, very fat, very smart, very tired of being himself. He has photographic memory and zero patience for things like tests, licenses, and the slow grinding boredom of becoming qualified. So he just skips that part. He picks a profession, he picks a name, he shows up. In 1950, while pretending to be a lawyer, he meets a young Canadian doctor named Joseph Cyr. Real doctor, real credentials. Demara, charming as ever, asks Cyr if he can borrow his medical documents, just to study, just for reference. He is thinking of getting his own license, you understand. Cyr hands them over. Demara disappears. A few months later, in March of 1951, a man calling himself Dr. Joseph Cyr walks into a Canadian Navy recruiting office in St. John, New Brunswick. Canada is at war. Canada is short on doctors. Canada does not check. The paperwork that should take months takes days. Dr. Cyr is now Surgeon Lieutenant Cyr. He is sent to HMCS Cayuga. Now, you would think, on day one, our hero would try to keep a low profile. Maybe stay near the bandages. Maybe avoid anything sharp. Instead, his first medical act on board is to pull a rotten tooth out of the mouth of Captain James Plomer, the captain of the ship. Demara has never pulled a tooth in his life. He pulls it. The captain feels better. The captain likes him. This is going great. Then come the sailors with skin infections, the cuts, the fevers. Demara handles them by, and this is real, sprinting back to his quarters, flipping through a medical textbook, then returning calmly to the patient like a man who has been doing this for 20 years. He has a sick birth attendant who actually knows things. He has a generous supply of antibiotics. He has somehow the confidence of God. Nobody dies. People get better. The legend of Dr. Cyr grows. And then, one night, the war shows up. The Cayuga is off the coast of Korea. 16 wounded soldiers are carried aboard. Some of them are not going to make it without major surgery. There is one surgeon on the ship. That surgeon is Ferdinand Demara, who, may I remind you, learned anatomy from a paperback. He orders the men into the operating room. He orders the staff to prep them. Then he excuses himself, walks calmly to his cabin, opens his textbook, and speed reads chest surgery. Then he comes back. He opens up a man's chest. He removes the bullet. The man lives. He amputates a foot. The foot patient lives. He does it 15 more times. They all live. All 16. The Canadian newspapers find out. Hero doctor. Saves lives off Korea. Removes bullet from soldier's chest. This is the kind of story you frame and hang on the wall. This is the kind of story that gets you medals. This is also the kind of story that gets read at breakfast in a small town called Grand Falls, New Brunswick, by an old woman, the mother of Dr. Joseph Cyr, the real one, who is, at that exact moment, in his own clinic, treating his own patients, in his own actual life. She picks up the phone. A few days later, a signal arrives at HMCS Cayuga. Captain's eyes only. Have reason to believe your medical officer is impostor. Investigate and report. Captain Plomer refuses to believe it. This is the man who pulled his tooth. This is the hero of the wounded. This cannot be a fraud. They confront Demara. According to Commander Peter Chance, who was actually there, Demara blew up. Then, after 3 days locked in a cabin with sedatives, he confessed. Now, before we laugh at this guy, hold on a second. Because there is something deeply familiar here, and it is not war or surgery. It is the man hiding in the cabin, reading the textbook 5 minutes before the meeting. You have done this. You have nodded through a meeting using vocabulary you Googled in the bathroom. You have started a new job and felt, every single morning for 6 weeks, that any minute now somebody will tap your shoulder and say, "We know." You have rewritten your resume to make a 3-month internship sound like a regional command. Demara is the extreme version of every person who has ever winged it. The difference is, when you wing it, the worst thing that happens is a confused client. When Demara winged it, 16 men with bullet wounds woke up alive. The Canadian Navy, in a decision that says everything about how embarrassed they were, decided not to press charges. They drove him to the border at Blaine, Washington, and handed him back to the Americans like an oversized package nobody wanted to sign for. In 1961, Hollywood made a movie about him. Tony Curtis played the lead. Tony Curtis is very handsome. Demara, by every account, was not. He watched the movie. He apparently enjoyed it. So, picture this. You are a Korean soldier with a bullet in your chest. The man holding the scalpel has read about your operation for the first time approximately 4 minutes ago. You will be fine. You will walk out of this. You will tell this story for the rest of your life, and nobody will believe you because nobody believes a story like this. Neither did the Navy.